Well, my name is Lucretia, and I'll be your student nurse. Can you please state your name and date of birth? Okay. Well, I have your medication that your physician ordered, and your first medication is your allopurinol, and I will check this against my MAR. Your physician, he ordered 100 milligrams, which is equal to one tablet, and you will be taking this by mouth. Now, one of the reasons you'll be taking this medication is to help reduce production of uric acid to prevent those attacks with gout. Some side effects are anorexia, nausea and vomiting, diarrhea, swelling of the mouth and lips, dizziness, headaches, rash, itching. You may have a metallic taste in your mouth, a bone marrow depression, and retinopathy, which is damage to the retina of the eyes. Your next drug is meloxicam, and your physician ordered 7.5 milligrams, which is equal to a half a tablet. I will compare this with my MAR. You will take this by mouth with or without food. Now, this is a non-steroidal anti-inflammatory agent, and it helps reduce fever and inflammation, mostly help relieve some of the symptoms that you are experiencing with your osteoarthritis. Some side effects are increased GI discomfort, kidney damage. You may hear noise or ringing in your ears. You may have some dizziness. I would like for you to report any nausea, fatigue, jaundice, which is like yellowing of the skin, the mucous membrane, or the whites of your eye. If you have any upper tenderness on the right side of your stomach, this could mean liver damage or trouble with your vision. Pioglitazone is your next drug. You will take 30 milligrams, which would be 2 tablets, and you will take this one time a day. And I will also compare this to my MAR. And you will take this by mouth with food. Now, this is for stimulation of insulin receptor sites to lower glucose in the blood and improve the action of insulin. And this is for type 2 diabetes, and this can be taken with metformin. Some side effects will be a headache, hypoglycemia, or anemia. Your next drug is your acetaminophen, and your doctor had wrote for you to take it every 4 hours as needed. And he ordered you 650 milligrams, which would be 2 tablets. And I will compare this with my MAR as well. And you will take this by mouth with or without food. Now, this drug is an antipyretic, and it is for mild pain and fever. Some side effects is liver damage or failure if overdose occurs, neutropenia, leukopenia, a rash, taken with NSAIDs will increase your risk of adverse kidney effects. Trelegy Ellipta inhaler is your next medication, and you will receive 1 puff daily. And I will compare this with my MAR, and you will inhale this medication. Now, it is indicated as a steroid, anticholinergic, and bronchodilator. These medication works by relaxing the muscles in the airways to improve breathing. Some side effects are coughing, diarrhea, loss of appetite, nausea, pain in the nose and mouth, stomach pain, bone weakness, and it increases your risk of pneumonia. Your next medication is levofloxacin, and you will take this every 24 hours. And your doctor orders 750 milligrams, which is equivalent to 30 milliliters. So this will be an IV, and it will be diluted with the appropriate solution, and it will be infused over 90 minutes. I will compare this with my MAR as well. It's indicated as an antibiotic used to treat, urinary tract infection and a wide range of gram-negative and positive infection along with pneumonia. Some side effects are hypersensitivity, nausea and vomiting, diarrhea, headache, dizziness, photosensitivity, and some rare effects include confusion, hallucinations, psychosis, and tremors. Rocephin is another antibiotic that your physician ordered, and you're going to also take that every 24 hours. He ordered 2 grams in 50 milliliters, and it will be infused over 30 minutes. And some side effects of it is nausea and vomiting, diarrhea. It can increase your glucose, and you might have thrombocytopenia. Anaphylaxis can occur as well, which is an allergic, life-threatening reaction, which makes it difficult to breathe, along with nephrotoxicity. Another drug your doctor ordered is guaifenesin, and he ordered this every 4 hours as needed. You may know this drug as Mucinex. The dose is 200 milligrams, which will be a half of a tablet. And I will compare this with my MAR, and you will take this by mouth. It works by thinning and loosening up the mucus within your airways, so you may find it easier for you to cough up your secretions. Some side effects are dizziness, headache, nausea, diarrhea, stomach pain, vomiting, and a rash. Connor, there's one medication that I have to contact your physician about, and that's the 1% diclofenac topical agent. He ordered for you to have it 4 times a day. When I mean topical, I mean something that you can rub on top of your skin. And we have a 3% strength, and he wanted you to have a 1% strength. So I'm going to contact him about that and see what his next step is going to be as far as supplying you with a cream to help relieve the pain from your osteoarthritis. And that's all your medication for this morning. Connor, there are certain labs and diagnostic studies that your physician will do. He can complete a culture and sensitivity test that will help identify the type of bacteria that's causing the infection and help guide treatment. Right now, you're being treated for pneumonia. We will do a complete blood count, which will include your red blood cells, your white blood cells, and your platelets. A basic metabolic panel will be used to measure your glucose, your sodium, your potassium, your calcium, your chloride, your carbon dioxide, your blood urine nitrogen, and creatinine. This will give us a general picture of how well your fluids are balanced, your electrolytes, and how well your kidneys are functioning. Your prothrombin time will also be measured to give us an idea of how well your blood is clotting. You are taking some medicine that will cause you to have an increase in bleeding, and we want to make sure we are monitoring it. You will also have your serum uric acid levels checked, and that relates to your gout. And your physician can also do a hemoglobin A1C, and this will be a good indicator of how well you have been monitoring your diabetes in the past 3 months. Connor, there are some things I would like to teach you about your medications. And one thing I do want to reiterate is that in the next 30 minutes, I'm going to recheck your level of pain because we gave the acetaminophen earlier. And I just want to make sure that it is decreasing. And when you are at home, I want you to keep track of your temperature and your blood pressure, because a temperature is a good way to see if you are getting an infection. I want you to always consult with your doctor before you take any medications outside of the ones that he has prescribed for you, especially over-the-counter medication and herbal supplements. Also contact your doctor about any rashes that you may experience, itching, visual disturbances, edema, bleeding, and black stools. And black stool is a good indicator to see if you are bleeding within. When you are at home, I want you to never double your doses. If you miss a dose, do not take the one that's due as well as the one that you miss. Only take the amount of medication that's prescribed. Avoid products with aspirin. Also avoid alcohol, caffeine, and large doses of vitamin C. As it relates to your gout, I would like to help you make some dietary changes. one thing I want you to do is reduce purine foods. And some examples will be seafood, anchovies, sardines, organ and red meat, like liver. Make sure you're getting your yearly eye exams because some of the medication that you do take, it interferes with your vision. And since you are diabetic, I would like us to discuss some signs and symptoms of hyperglycemia as well as hypoglycemia. And what do I mean? I mean when your glucose is high and when your glucose is low. So with hypoglycemia, I want you to remember this. Cold and clammy, need some candy. And you will experience some signs and symptoms like sleepiness, hunger, you'll have a lack of coordination, sweating, and irritation. Now with hyperglycemia, which means your glucose will be very high, you will be hot and dry, your sugar high. And some signs and symptoms will be increased thirst, frequent urination, blurred vision, weakness, and headache. And then we'll conclude our teaching for today.